point. Yep, got it. Recording in progress. Well, good morning, everyone. So there's a Janelle and a Danielle, and I feel like I'm going to jump in at the wrong time often. So, but good morning. So today I thought we would start, just sort of the basics of family work, just kind of getting us in that mindset to think about systems as we do our work. We chose to do the ECHO as a CBT/family systems ECHO because it's so important. And so I really appreciate you all participating. Today isn't going to necessarily be focused on families and CBTP together. It's more of a general overview, but the goal throughout ECHO is really designed to help us sort of learn how to integrate the two worlds together just more naturally in your practice. So just out of curiosity, show of hands or little emojis, how many people are pretty experienced and comfortable working with families and loved ones for adult clients? Kind of, sort of. When I talk to people from the child world, that's commonplace, right? But for those of us that work in the adult serving system, things look a little different. So awesome. All right. I see a thumbs up from Janelle. Thanks. So we have a few people who are pretty comfortable. Well, someplace I like to always start is when I say the word family, what comes most readily to mind? Words, phrases, you can throw them in the chat. Feel free to unmute and throw out. When I say family, what do you think about? About parents, supportive friends and family. Yep, absolutely. Good one. Anything else come to mind? Well, as we go through today, when I'll probably be going back and forth between saying loved ones and family, but what I really mean are, friends and family, people who are supportive of and who care about the individual with whom you will be working. It could be a blood relative, a neighbor, an extended family member, immediate family member, adult child, neighbor, friend. Really, the key is just to think about this broadly and inclusively as we talk and as we go through this ECHO in your work. So why families? Why now? Oftentimes family systems, I don't know, from your experience, I've been here about 10 years, and oftentimes, the cases that I get to hear about, families are frequently viewed as problematic. The phrases that I hear oftentimes are they're completely uninvolved or they're too involved and they kind of monopolize sessions, or the whole family's unwell, or there's this toxicity within the family, or they're enablers. And so we hear a lot of language around that. And so, I think those are important descriptors about our experience sometimes when it's working with families. And so the goal of this ECHO is to really help us to kind of shift gears a little bit into more solution focused kinds of way about thinking about working with families, because they can be our greatest asset, truly. We're often thrilled to pieces when an individual has a supportive and knowledgeable loved one involved or loved ones involved, but actually this could and should be the norm in our practice. And so, the goal is to move toward in that direction. Loved ones can truly be a help or a hindrance to our work. They can make our job a whole lot easier, or they can make it more difficult. And what we often don't think about is much of that is determined and driven by us as the provider. Because they need a roadmap. So you'll see these little pictures on the bottom on the left-hand side. Sometimes it can feel like there's this push and pull with families, or some sense of resistance with family members, or it feels like there's this huge chasm between us. We just can't get on the same page. We're on two opposite sides of the playing field. And what it is that, the goal, you'll see the yellow star, what we're trying to work towards is we really want to provide a roadmap for families with whom you're working with their loved one, kind of thinking of yourself as a guide. Highlighting important stops along the way, coming up with the plan to reach a destination, rerouting them if they get off course. And so if we think about ourselves as providers in this kind of way, it kind of reframes the conversation and maybe makes things a little bit more open and a little less intimidating when we're thinking about working with families. So, the goal is to start thinking about how do we get to help families fall in that sweet spot of involvement, not over-involved, not under-involved. And we're going to see a lot of variability in families, which is the norm. So you're going to hear about a lot of different families as we go through these case consultations and case presentations, which I'm excited about because it just helps sort of bring this idea to life about where do we get them to fall in that sweet spot. So I'm not going to go into too much detail. I just wanted to highlight a little bit, but this is a little bit about a whole lot of research. So there's 35, 40 years of literature that says involving supportive and knowledgeable loved ones in treatment is sort of mission critical to outcomes for everybody involved. So not just client outcomes, which is the most exciting part. So, when you have knowledgeable and supportive family members, which that step one is getting them involved, helping them to learn how to be supportive and giving them the information they need. And when they're sort of up to speed and ready to go and be supportive of the individual in treatment, you really do see reductions in relapse and rehospitalization rates. And this is oftentimes due to because people aren't having as many symptoms, or they're better controlled because they are more adherent to all treatment recommendations, including but not limited to medication. The family's feeling better, they're feeling more positive, they're feeling less weighed down. We see the family relationships are improving, people are getting back to work, getting back to their social lives, and that's not limited to just the client. And from our side of things, costs of care, if people aren't going back to the hospital and there aren't as many crisis services because families learn how to intervene early, that really benefits the system as a whole. And I'm sure you all have heard Val and Harry talk a lot about, the schizophrenia patient outcomes research team. And I just wanted to highlight something that's been in these guidelines since their inception back in, I think it was 92 or 1994. But the recommendation is to provide family-based services. And in an ideal world, it's family psychoeducation, which is, at least 6 to 9 months. But we still see positive gains and more positive outcomes if you do at least 4 family sessions in less than 6 months' time. The gains may not be as robust, but it's a great place to start. So basically what all of this boils down to is family involvement is important and it's doable, and it's really necessary to improve outcomes for everyone. So what can we do? All of us here on this echo, where do we even start with this? And I always like to say, start by thinking systemically when you're conceptualizing your cases. And, what do I mean by that? So when you're thinking about your work with an individual, it's really key to think about that person in a larger system. Everything that's going on in their environment with the people around them is impacting that individual and vice versa. So whatever is happening with the individual you see for treatment is impacting those people around them and what's going on. And so kind of being sensitive and aware of that, and being mindful that when we're involving families or even introducing the idea of involving families, some of these things that we won't go into detail today, but these will be fleshed out as we do conceptual case presentations, is thinking about, the cultural factors or the belief systems, the traditions, spirituality, things that really have an impact on the system in a much greater way, and they can impact different members of the system differently. And so how do we start to get a picture of that? Life experiences, trauma, all of these things that come into play when you're conceptualizing an individual's case. The same is true for the families. It's just an extension of that individual. And we really have to be mindful and aware of what's going on with them. Otherwise, we're not really treating the whole person. And sometimes we get caught in this place of making recommendations that work directly against the belief system of a family. And if they live at home with family, it's like, who do I please? I don't want to upset my treatment provider. I don't want to upset my family. They're on opposite ends of the continuum about these recommendations. So I'll just say I'm doing whatever the provider is recommending so that I don't, upset them. I want to be a good, treatment recipient. And also I want to keep things good with my family. And so really, we can put people in precarious positions if we're not careful about the recommendations we make, if we don't know the larger system's beliefs about that. So, once you have your case conceptualization, you're going to start working with the client and the family together to identify goals and needs. Most loved ones want to be heard and they want to be understood. They want to be helped and receive help, but they also want to be part of the team and be of help to us. They just oftentimes don't know what that looks like. And it's up to us to, again, be that roadmap to guide them in that. The only way to know what it is so that what their goals are, or what it is that they need, is by asking them and meeting them where they're at. We have that saying a lot with clients, meet them where they're at. The same is true of family systems that you'll be working with. The best way to achieve a goal, obviously, is by coming up with a solid plan, and families and loved ones can really be a huge help to support the success of that plan. But loved ones need to understand what the plan is, what the goal is, and they need to have some level of investment or buy-in of that plan and of that goal. And so involving them early, it can be really key. And briefly, making sure that we're aligning goals and needs and values, not just of the client with that individual person, but thinking bigger about the team, other family members who have some level of involvement or investment. And finding common ground is always the best place to start. And that can feel really difficult sometimes. And so sometimes the place to start with, we can all agree that we want the individual and you as a family to be living really happy and fulfilling lives. We may not agree on the path to get there, but we can all agree that that's the end goal. And then, sometimes that will bring some of the walls down when there is a little bit of tension between individuals and families. So, when times are a little bit tough or a little trying when you're moving forward in this kind of work, one thing to remember to keep in mind is that loved ones are most often well-intentioned, but they're often in survival or self-preservation mode. And so, we have to really figure out what are their intentions, what are their motivations, what are their needs to pull them online, and really finding the good in what they're doing. Because as frustrating as it can be to feel like they're working against recommendations, what is it that is motivating that? Do they feel like, they're protecting from something, they're protecting their loved one from something, for example. So now you have some idea about the direction you're headed. We have picked out our destination and our goal, and where do we start? How do we get our engine started and hit the road? And sometimes starting by as simple as how we're defining engagement and what we consider engagement, because that's going to look different for every single family, and within families it's going to look different over time. So how we're thinking, sometimes we think, well, this family isn't engaged at all, but they return every phone call, they bring everybody to the appointment each week. And so what does the definition of engagement look like? And does it fit this family's needs and abilities and capacities at this particular time? Are there things that might be getting in the way of them being as involved as maybe they once were? What's worked in the past to get them engaged? What hasn't worked so well? It's really about, is everybody on the same page or at least in the same ballpark? Then we're going to move on to start thinking about expectations, ensuring that they're realistic and reasonable and feasible. And these aren't just expectations of the client. I think sometimes that's where our minds go. These are really talking about expectations of everybody involved. What are the expectations of the client, of the family, of us as the providers, of the mental health system or your agency, of extended family members? It's really difficult to meet somebody's expectations if we don't know what they are. And so oftentimes we find ourselves, setting people up for disappointment because we haven't done the legwork at the front end. So that's a really important thing to think about. And also being mindful of and aware of our own expectations. Sometimes this is just sort of an automatic thing. Well, we just assume you're going to make sure that this individual shows up to appointments or takes their medication. But is the family aware that this is our expectation? Have we checked in to see if this is still reasonable at this time for the family? Have we made adjustments over time based on what's going on within their family system? And being mindful that there are going to be limits to what families can and should be really expected to do, or what we're hoping or asking of them. We don't want to put them in dual roles or uncomfortable positions that create tension within the family, because obviously we know that can lead to increased symptoms. So, if all of these kinds of things are done well, it can really, really help to decrease stress and tension, not just for the individual, but the family system as a whole. Always think about facilitating engagement and taking a stepwise approach, first figuring out the who that might be involved, talking to clients about what that might be like to get them involved, and then really, once we're all on the same page, educating, informing, and supporting individuals. So, that thinking about the who of who may be a good person to involve, and it may not be blood relatives, that broad inclusive definition, and being mindful of that. One way to ensure you won't be shut down right away is, I always say, avoid using the word families or family right away, because if somebody doesn't have a good relationship and they think blood relative, sometimes that can automatically shut a conversation down. So some other things that you can, ways to approach it could be as simple as, who do you talk to if you're having a rough day, or who would you like to talk to if you were having a rough day, or who would you call in an emergency, or who do you wish you could call? And sometimes this can tell us, relationships that have been damaged that they'd like to repair, and that can lead to some goal-directed behavior. Another really, really important question that we don't ask often enough, but it really is important to a client's self-worth and value is who calls you if they're having a rough day, who calls you if there was an emergency, or who do you wish would call? And so that really flips that question on its head, and it's such a simple reframe, but it can be really, really impactful. Obviously, once you're figuring out who to involve, talk to them about what it might be like, the good, the bad, and the ugly of involving the loved ones. What are their hesitations? What might go really well? What could go wrong? And if you get to a place where they're ready to kind of reach out and start engaging with family and involving them in care, you know, providing information to families that they have a role to play and what that looks like, and you're there to support them. Provide them with resources, you know, in-house or things like NAMI. Making phone calls to family members just to check in to see how they're doing. If you know client had a rough week, that probably means family had a rough week. So that can go a long way with rapport building. And I won't go into this just for time, but there is a really fabulous reorder approach. It's a gentle kind of way to ease into the discussion with clients and family members about getting them involved. And after this sort of 6-session approach, you could really dive into more CBTP/family work. So if you're interested, feel free to reach out to us, and the citation is also at the end. So one just sort of caveat, disclaimer, and rule of thumb to always think about is safety first, making sure there's no orders of protection or history of domestic violence, making sure we check in about, you know, how does your family communicate? How do you argue? How often does that happen? What does it look like if things, you know, kind of escalate? Do you ever get into the pushing and shoving, or does it always stay, you know, with kind of verbal disagreements? So really being mindful to do a thorough assessment from each person's perspective about what that looks like. We want to provide support information and resources, support both for the individual family members themselves and support in their efforts to support the client. That's a whole lot of support words. But it's very important because they're going to be testing the waters. They're going to be trying new approaches with their loved one. And so it's very important that they have, you know, sort of support where they can check in with you to see how that attempt or that interaction went. Ensuring they understand they have a role, helping them learn when to step in and maybe take on a more involved role, and also when to step back out, which can be a very anxiety-provoking time for families because they want to protect them, you know, so what is that balance and that safe place for allowing autonomy? And then providing enough information without overwhelming them with too much info too quickly. So the last thing is sort of just as we move forward in this echo, really thinking about how might loved ones actively participate in your sessions, especially those CBTP sessions. You know, what might it look like? How could it be beneficial to both the client and their loved ones? You know, what could this be? And so we're just, you know, kind of wanted to lay the foundation of what family work can look like. And then as we go through the echo, you're going to be learning different techniques and strategies through the case presentations and the didactics about how to do that. So I won't go into these, but there's a couple FYIs about certified family peer supporters. It's just what it sounds, peer support for family members of clients who are 21 or younger. And there's also, if you want 2 free CEs, you can go to the E-Academy. Information is on here. It's like Family Basics 101 for anybody who's interested. So I think that's my time. Thanks for listening.